Hi mates, welcome to my YouTube channel. My name is Praxiris Lydia. Kindly subscribe and turn on the notification bell. Our topic today is about dysmenorrhea. Dysmenorrhea is the medical term for painful menstrual periods. This usually occurs when your uterus contracts to shed its lining. The pain typically begins just before your period and subsides a few days after your period. We always have two types of dysmenorrhea, the primary and the secondary dysmenorrhea. Primary dysmenorrhea usually primary dysmenorrhea is the recurrent pain that occurs without no identifiable cause. This is the most common. While secondary dysmenorrhea results from a condition or an infection in your reproductive organ. Pain from secondary dysmenorrhea usually occurs earlier in your menstrual cycle and lasts longer than typical menstrual periods. Like for instance, you might experience the pain several days before starting your period, and the pain will continue until the bleeding completely stops. Secondary dysmenorrhea is less common, and having dysmenorrhea is normal. It might improve after giving birth. So let's talk about the causes. The painful periods are caused by chemicals called prostaglandins, which causes your uterus to contract. During menstruation, these prostaglandin levels are higher in your body, thus causing your uterus to contract more strongly, thus the cramping and discomfort. Okay, the symptoms of dysmenorrhea are headache, dizziness, pain in the inner thighs, pain in the lower back, nausea, fatigue, diarrhea, bloating, etc. One is more likely to experience dysmenorrhea if they had their first period before the age of 12. If they're smoking, if they're having heavy periods, and also if your biological mother had dysmenorrhea, it also increases your risk. Also take note, if your menstrual cramps are so severe that they interfere with your normal daily activities, you must be having secondary dysmenorrhea. These might include like endometriosis, fibroids, pelvic inflammatory disease, or adenomyosis. Please consult your healthcare provider to rule out what medical condition you're having. Both primary and secondary dysmenorrhea are treatable. The tests may include the pelvic exam, ultrasound, hysteroscopy, and laparoscopy. Okay, let's finalize with the medical and medications, with the management and medications. Like you might be taking the painkillers to relieve the pain, such as the NSAIDs, hormonal medications such as the pill. You can also use a heating pad on your abdomen when you have cramps to relieve the pain. You can get extra rest. You can exercise regularly, like you can do yoga or breathing exercises. That is said and done. Thank you so very much for watching. Let's catch up on my next video as we talk about the recommended diet during menstruation. Kwaheri.